time for the federal government to step up and to support our friendship centers in creating first-line services and invest in us.
Indigenous Friendship Centres are on the front lines of urban health in Canada, yet they remain overlooked and underfunded. That's according to experts that urge the new Carney government to act now to provide stable funding and recognize their vital role in healing Indigenous communities.
If we want a strong Canada, we need a strong urban Indigenous community, and we need to be recognized as key players in delivering on all of that.
The Friendship Centre Native Montreal serves up to 400 people, offering everything from medical checkups to traditional ceremonies. But resources are stretched thin.
We only have a doctor 2 days a week. We only have one nurse. There are only 200 patients part of our clinic. There's 10,000 Indigenous people who live in Montreal, and we should be able to run a full clinic 5 days a week. Be able to run it. Right now, it's empty for a simple reason. We just don't have the medical capacity.
Now they're calling for systemic change in Indigenous healthcare access.
We want to see change where the federal government is really investing in our centers as a primary care location for so many Indigenous people that just don't have family doctors, that don't have first-line care, and would access that care through our more than 100 friendship centers across Canada.
What sets these centers apart is cultural safety, something that experts say mainstream healthcare can't offer.
When you face a big institution, these institutions, no matter how hard they train people, they will never become culturally safe. They're just very intimidating spaces where a lot of abuses happen.
Experts say without sustained federal investment, Indigenous health disparities will persist and friendship centers won't be able to meet the growing needs of their communities. We reached out to the Indigenous Affairs Minister's office for comment, but did not hear back in time for broadcast.
When long-term issues are there, with youth protection, with general health of the Indigenous population, we underfund us, and that makes no sense.
In Montreal, Adriana Gentile, City News.